Good evening. Today I'm going to take a brief introduction of what is ethics in medical research and what, as a basic, we have to follow the ethics in our medical research. Now, the ethic in medical research, there is a recent national ethical guideline for biomedical and health research, which is published by Icmr. It's available in the website of the Icmr. And I think if any person is going to do any medical ethics, he should read this document fully. Now, why this ethics is important? Because in the past, it was many dark stories. In 1963 to 66, Willowbrook study, in which in mentally disabled child, they have seen the natural progression of the liver disease by injecting hepatitis virus. There's a lot of hue and cries for these studies. Then the thalidomide tragedy, we all know that this drug which was studied has led to about 5,000 to 7,000 infants were born with phacomelia. Then come 1963, Jewish chronic disease hospital study, in which the purpose of this research was to determine how a weakened immune system influenced the spread of cancer. And in this study, there's no ethical approval, no consent form, patients were not informed, and the researchers found guilty of fraud, dacoit, and unprofessional conduct. Then there's a syphilis study, in which about 300 mostly indigenous African American who are untreated. They have seen a natural history of syphilis, and they are untreated many years after penicillin was known to cure syphilis. So in 1964, there's a declaration of Helsinki in June 1964. And this is very important. It is a set of ethical principles regarding human experiment. And the most important thing, subject must be informed of aims, methods, anticipated benefit, potential hazard. Freely given consent must be obtained, preferably in writing. In 1978, the Belmont report created by the National Commission for the Protection of Human Subjects of Research, which says the respect of person, beneficence, and justice to be given to all the participants. Then come ICH introduction in 1990, which is known as International Conference on Harmonization of Technical Requirement for Registration of Pharmaceutical for Drug Use. What are the types of research? There's basically, the research may be a basic research, the preclinical research, which include animal experiments, cell studies, biochemical, genetic, and physiological investigations. The clinical study performed on man to study the clinical or pharmacological effect of any drug or device or treatment. It may be two types of studies: an academic research, which is sponsored by an institution. It may be interventional, non-interventional, and it may be clinical research sponsored by pharma. Clinical trial, any investigation in human subject intend to identify adverse reaction to investigation product, clinical and pharmacological effect, and to study absorption, distribution, and metabolism of IP is a clinical trial. And there's a different type of clinical trial depending on what the researchers are studying, like treatment research, prevention research, diagnostic research, screening research, in which there's a quality of life research, genetic studies, epidemiological studies. So these are very different type of clinical research which a person is going to conduct. You should also know a very few minutes of drug development and clinical trial phases. Now, drug development have a lot of milestones in that. Preclinical drug development, identify for drug target, drug screening, small scale production, then laboratory and animal testing, production for clinical trial, and then they file for various approvals. The drug development, there's basically a 4 phase, a preclinical, clinical trial, phase 1, 2, 3, and phase 4, which average takes about 10 to 15 years. And usually the phase 1 is mainly for safety of drugs. Phase 2 is short-term safety and efficacy, maybe placebo control, and with multiple doses. And phase 3 is basically long-term safety of doses, effectiveness of that drugs. So usually the time interval from the phase 1 to phase 3 trial is approximately 7 to 10 years. There's two important authority are DCGI and Icmr. We should always know. The DCGI is a drug control journal of India. All pharmaceutical company sponsored clinical trial in India must be registered with DCGI. When is Icmr approval required? Any application for academic or university research project involving foreign assistance and stem cell therapy and or collaboration in biomedical health research are to be submitted by the Indian investigation to Icmr for approval of Government of India through HMSC. So if you have any foreign collaboration, if you have any investigation product going to the foreign country like your investigation, then it has to be, the approval from HMSC needs to be taken. The collaborative research, you should also know what is an ethical issue surrounding a collaborative research. They are the point, how you are sharing the data, technology, what the ownership of material, data, IPR, joint publication, managing research finding, management and commercialization of research outcome. So these all issues need to be taken ethically when you are collaborating or research with other institution, inter-department, inter-institution, inter-country. With the progress in the era of cellular and molecular biology, the following points are important. Safety during transfer, that is very, very important. You are transferring a biological material. The safety need to be ensured. National security need to be ensured. People cannot make a biological weapon. So a national security risk from the defense and internal security point of view of the country, IPR, potential for commercial exploitation, Institute Ethic Committee clearance to be submitted for each of the participant center site at the time of submission of proposal to Icmr. Project will be rejected by HMSC in the absence of Institute Ethic Committee certification. So that is very, very important when you are doing a project on cellular and molecular biology. These are various type of risk assessment during research, like less than minimal risk, what is probability of harm or discomfort anticipated in the research is nil or not expected. Minimal risk, low risk, and high risk, like probability of harm or discomfort anticipated in the research is invasive and greater than minimal risk. So this is a type of risk determination during a study or conducting a study. You have to have ethical committee because all the ethical research proposal need to be passed by your ethical committee, whether it's a retrospective study, it's a data collection, even if you are doing some 2 or 3 case reports, it has to be approved by your institutional ethics committee. So reviewing and what is the role of ethics committee? Design of the trial, suitability of the investigator, suitability of the facility, method and material, favorable risk-benefit assessment. The primary purpose of such review is to assure the protection of the human subject. These are the various members which is designated by Icmr, and you can go to Icmr website, find out how your ethics committee should be formed. You should have a chairperson, vice chairperson, member secretary, basic research scientist, clinician, legal expert, social scientist, layperson. All are important for constitution of ethics committee. The ethics committee should be multidisciplinary, competent, and independent in its functioning, with the chairperson and 50% members as non-affiliated. Means your chairperson and 50% of members should not be from your institution. And these are various guidelines how to form the quorum, how to take decision. She should form a subcommittee for SAE. SAE means side effect assessment subcommittee or anything. So these are the various norms, SOP of the ethics committee, which is given in Icmr website. Now, gender issues. That is the gender issues. When you are doing a research, these are the gender issue. All research involving human participant should be conducted in accordance with the basic and gender ethical principles. And what are the various principles? First, the principle of essentiality, whereby after due consideration of all alternative, in the right of existing knowledge, the use of human participant is considered to be essential for the proposed research. This should be duly vetted by an ethics committee. Principle of voluntariness, You cannot force anybody to participate in the study. Principle of non-exploitation, whereby research participants are equitably selected so that the benefit and burden of the research are distributed fairly and without arbitrariness or discrimination. Principle of social responsibility, that is very, very important. Principle of ensuring privacy and confidentiality. This is the most important thing, that whereby to maintain privacy of the potential participant. That is very, very important. You cannot disclose the name of participants during your research. Then principle of risk minimization. When you are doing a research, you have to minimize the risk. That is the utmost important. Principle of professional competence, whereby the research is planned, conducted, evaluated, and monitored throughout by a person who are competent to have to do this research. Principle of maximization of benefit and principle of institutional arrangement. These all need to be followed when you are conducting a research. Then principle of transparency and accountability, whereby the research plan and outcome from the research are brought into the public domain through registries, reports, and scientific and other publication. Principle of totality of responsibility, whereby the stakeholder involved in research are responsible for their action. This is very, very important. And 12, principle of environmental protection, whereby research are accountable for ensuring protection of the environment and resource at all stages of the research in compliance with the existing guidelines and regulation. So what is other general ethical issues? Benefit risk assessment. That is very, very important. Benefit to the individual, community, or society refer to any sort of favorable outcome of the research. The researcher, sponsors, and EC should attempt to maximize benefit and minimize risks. And the C is informed consent process. That is very, very important. So the informed consent process need to have this all requirement. The informed consent document, which include patient information sheet and informed consent form, both should be incorporated, and element informed consent document should all be written in this informed consent document. For our biomedical and health research involving human participants, in the principal responsibility of the researcher to obtain the written informed consent of the prospective participant or legally acceptable authorized person. In case of an individual who is not capable of giving informed consent, the consent of the LRA should be obtained. So consent is very, very important. Now, recently from 2013, in certain circumstances, audio-visual recording of the informed consent process may be required. For example, in certain clinical drug trials. So in that, you have to take a full audio video consent form, which is being, how to take it is being given in your Icmr website. These are the various conditions in which you can grant waiver of consent from the ethics committee. But this has to be given by ethics committee. You have to apply that, because I am doing a retrospective study, there's no prospective study, I am just doing a data analysis, so the consent may be waived. So you have to apply to ethics committee, and it is only the right of ethics committee to waive the consent for the study. The privacy and confidentiality need to be maintained at all level of your research. So if you are going to go research, kindly read these documents, how to maintain privacy and confidentiality. Distribution justice, payment for participant. Yes, you cannot direct bribe the participant. So there is a certain applicable principle for reimbursement for expense incurring in travel, incurring in loss of wages and food supply, that you can provide to the patient, but you cannot bribe or give any incentive for these patients. Compensation, that is very, very important. So the compensation for research related harm is very, very important, need to be mentioned in your informed consent document, will need to be vetted by your ethics committee, and it is the responsibility of the host institute to provide compensation. And how to calculate compensation in adverse effect, and you have to report all adverse event. It is generally written in that document, which adverse event to be reported to ethics committee, in which time, then which adverse event to be reported to the Dcgi. It's all given in your that document. So you have to have known how to report adverse event. There may be an adverse event, there may be a serious event, adverse event. A serious adverse event is when you die, it's a life-threatening, a cardiac arrest, inpatient hospitalization. So all hospitalization is basically an SAE. So compensation in case of injury, you have to provide free medical management, financial compensation. In case of death, there is a compensation formula which is given. You have to calculate and you have to provide compensation. So the compensation to be provided in all drug trial in which you are randomizing the patient, and these are the various formula which is being provided. Conflict of interest is very, very important. So all members has to disclose their conflict of interest when they are doing a research. Selection of vulnerable and special group as research participants. So there are various vulnerable population like economical and social disadvantage. The pregnant woman is vulnerable, the child is vulnerable, the old age is vulnerable, refugees. So these are all a list of vulnerable patients. This is very important. Post-research assess and benefit sharing. The benefit occurring from research should be made accessible to individuals, communities, and population whenever it is relevant. This is a criteria of authorship. It is given in International Committee for Medical Journal Editors, Icmr. They have clear-cut given that how should be the authorship be labeled in any research. Now, these are very important. What are the type of research misconduct? Fabrication in the international act of making up data, falsification in manipulating research material, plagiarism. These all are misconduct, and misconduct is now taken as a very serious thing in doing a medical research. For stem cell proposal should be reviewed and approved by an institutional committee for stem cell. Independent EC that function outside institution can be used by researchers who have no institutional ethics committee. So these are the new amendment in this, like the Constitution of Ethics Committee, they make a minimum of 7 members and 1 woman member is mandatory. That is the older one, and the left is a newer one, which is given in that Gazette notification. The important thing is what I'm saying, that if you have taken an approval for a research and you have not recruited any patient for 1 year, then you have to take again re-approval from the ethics committee, and after every 2 years you have to take approval from the ethics committee if you are doing a drug trial. Now these are various conditions for permission of clinical research. 6 monthly status report to be published, and what I have said that if 1 year has passed, you have to again take approval from the ethics committee. That is very, very important. Post-trial assess of investigation, new drug or new drug. If you think that this drug is being essential for the patient, only available drugs, then the ethics committee can ask the sponsors to provide this drug free of cost, lifetime to the participant. That is very, very important. And what is an academic trial? The academic clinical trial means a trial of a drug already approved for a certain claim and initiated by any investigator, academics or research institution for a new indication or new route of administration or new dose or new drug form, where the result of such trial are intended to be used only for academic purpose nor commercial purpose. So no permission from the higher authority need to be taken. However, all this trial to be approved by ethics committee. That is very, very important. In the whereas compensation, that is very, very important. The compensation for academic trial can be waived off. However, this need to be individualized and need to be approved by the ethics committee. But this is very important. Ethical principle including compensation, medical management in case of injury or death are applicable for academic clinical trials. So you cannot say that in academic clinical trials, these all not included. They all included in certain academic trial. If you want to exempt certain thing, it has to be, you have to take permission of the ethics committee. The good document practice, clinical documentation should be recorded and organized as being provided in this Gazette notification. That is very, very important. So all the documents, practically we say that the ethics committee document need to be stored for at least 5 years. So thank you for a kind hearing, and what I can say that doing medical research is at present has lot of restrictions, lot of ethical views, lot of legality. So kindly go and read the document completely if you are going to do medical research. Thank you very much for your kind